Welcome to Dog Dog Diaries. In this video, we will learn about mechanical asphyxia. What is asphyxia? Asphyxia is a term that is derived from Greek word and which literally means pulselessness. That means person cannot feel the pulse. What is the definition of asphyxia? Asphyxia is termed as a state in a living organism in which there is an acute lack of oxygen available for cell metabolism associated with inability of the body to eliminate excess of carbon dioxide. That means in a living organism there is a lack of oxygen, so oxygen will be decreased, carbon dioxide will be increased, so therefore the tissues are less perforated by oxygen. The body cannot eliminate the carbon dioxide, due to which this leads to ischemia leading to death of an organ, finally leading to death of a person. So this is termed as an asphyxia. So what are the forms of mechanical asphyxia? There are 4 different types. First is hanging, strangulation, third is suffocation, and the fourth is drowning. So these are the forms of mechanical asphyxia. So in this video, we'll just discuss about hanging. What is hanging? Hanging is a form of an asphyxial death that is caused by suspension of a person by a ligature. You can see this is a ligature, so which encircles the neck. And this constricts the neck, causing the death of a person. So what is the constricting force? The constricting force being the weight of the body. What are the types of hanging? So on the basis of position of knot, it is classified into 2 types, typical hanging and atypical hanging. In case of typical hanging, the knot is present at the nape of the neck on the back. Whereas in atypical hanging, the knot of the ligature is present anywhere other than on the occiput. In this picture, you can see that the knot is present over the occiput in the lateral aspect. So this is typical hanging. In the posterior aspect, the knot is present over the occiput. So this is typical. In the lateral aspect, the knot is present over the side of the neck and not over the occiput. So this is atypical hanging. Even in this picture, you can see that the knot is present over the occiput. So therefore, this is typical. And the knot is present over the side of the neck. So this is atypical hanging. On the basis of degree of suspension, it is classified into 2 types, complete hanging and incomplete or a partial hanging. What happens in complete hanging? The body is fully suspended and no part of the body touches the ground. You can see in this diagram, no part of the body will be touching the ground, but the body is fully suspended by the ligature material. So what is the constricting force here? The constricting force is the weight of the body. Whereas in incomplete or a partial hanging, the lower part of the body will be touching the ground. This victim will be sitting, or he will be kneeling, laying down, or he will be in a prone position. Which is the constricting force here? Weight of the head acts as a constricting force in incomplete or a partial hanging. In this picture, you can see that this is complete hanging. Why? Because the body is fully suspended, no part of the body is touching the ground. So therefore, this is complete hanging. In case of incomplete or a partial hanging, the lower part of the body is touching the ground. It is not fully suspended. The body is not fully suspended. So this is incomplete hanging. So based on knot position, we have studied typical hanging, atypical hanging. On the basis of degree of suspension, we have studied complete hanging, partial or incomplete hanging. There are other types of hanging based on the manner of death. It can be suicidal hanging, homicidal hanging, accidental hanging. In relation to death, there are two types: ante-mortem hanging and post-mortem hanging. Others include judicial hanging, autoerotic hanging, lynching, and rescue hanging. What are the causes of death in hanging? What are the immediate cause? Immediate cause is asphyxia. There is venous congestion because there is an obstruction in jugular veins. There is cerebral anemia. There is because of compression of carotid artery. This leads to cerebral ischemia, finally leading to cerebral anemia. There can be vagal inhibition. Vagus nerve or a carotid bodies, when compressed, may cause vagal inhibition. This leads to cessation of heart. That can occur because of combination of asphyxia and venous congestion also. There can be fracture in the cervical vertebrae. So these are some of the immediate causes of death in case of hanging. What are the delayed causes? It can be aspiration pneumonia, there can be infection, there can be edema of lungs, there can be edema of larynx. Oxygen supply to the brain will be limited, causing hypoxic encephalopathy. There can be abscess in brain. There is infarction in brain. So these are some delayed causes of death in hanging. Now let's study autopsy finding in hanging. How does the ligature mark look in hanging? As you can see in this picture, the ligature mark is oblique and it is towards the nape of the neck. And this ligature mark is present just above the thyroid cartilage. Abrasion can be seen over this ligature mark. What type of abrasion? Pressure abrasion can be seen. In this pictures you can see, so this is the ligature mark which is oblique and towards the nape of the neck. So this is pressure abrasion over the ligature mark. So this is a ligature mark which is oblique. What are the findings in eye? As the knot is present over the side of the neck, sometimes it presses the cervical sympathetic ganglion, due to which one eye will be closed, other eye will be opened, and the pupil will be dilated. This is considered as a vital feature and it is referred as a lay faciae sympathetic. What are the features you can see over the mouth and tongue? You can see dribbling of saliva. Why there is dribbling of saliva? Why? Because there is a compression of salivary gland and pterygopeloton ganglion. This is the surest sign of ante-mortem hanging. What about in specific organs like heart, lungs, conjunctiva? Petechial rashes. You can see this. These are petechial rashes. Petechial rashes, which is a non-specific finding, can be seen. What about hyoid bone? There is a fracture in hyoid bone. In case of hanging, in the greater cornu, there is an outward compression. This is the outward compression. Whereas in case of manual strangulation, there is an inward compression. What about carotid arteries? The tunica intima layer will be damaged. There is a tear in the tunica intima layer. So this sign is called as Amsut sign. What about cervical vertebrae? There is a fracture in C2 vertebrae. So this is termed as Angstman sign. What can you find in the limbs? Sometimes the blood will get collected in the upper limbs and lower limbs. This is called as glow and stalking hypostasis. Next, dissection in neck. Sometimes to prevent blood collection in esophagus and cervical spine, the dissection of the neck will be done at last. Thoracolumbar vertebrae. This is thoracolumbar vertebrae. You can see some Simon's hemorrhages. Simon's hemorrhages. So this is the findings in thoracolumbar vertebrae. So we have discussed totally 10 autopsy findings in hanging. So that's all in hanging. Thank you and keep supporting me.